Let's ponder some more on the government's announcement today. It's going to crack down, it says, on obesity. It's said that before, of course. Junk food advertisements, they're going to be banned. A new watershed on TV as well as online before 9 p.m. Shops, they'll not be allowed to display sweets and chocolates at checkouts. The Prime Minister also putting an end, he says, to the buy one, get one free promotions on high-fat products as part of his new Better Health campaign. Well, let's turn to the chef, Jamie Oliver, who joins us now, who's long campaigned on this subject. Do you feel a sense of vindication today, Jamie?
I'm actually quite surprised. I think we've been working in this area for the last 5 years, since Chapter 1 of the Childhood Obesity Strategy. And I think what we have now is a nice platform to really get on with business and really start doing all the things that matter in supporting our most vulnerable communities. So, yeah, this is about every child. And of course, it goes from the schools to the high street. And a lot of these initiatives have been driven by the public, you know, things like Pester Power and all the kind of sweets at kid height and at the checkouts. So I think, you know, it's a very interesting time. I won't deny that I'm surprised, but pleasantly surprised, and that doesn't happen so often these days.
We'll get on to some of the specific points you make about the Pester Power at the checkouts and the you know, the buy one get one free, the advertising watershed, all that stuff. But in terms of why it's happening now question, I suppose it's, if you look at the COVID data, I think 8% of critically ill patients in intensive care units, so 8% of them are morbidly obese compared to their prevalence in the population at large, which is closer to 3%. So there's obviously a correlation between being morbidly obese and being more susceptible to the serious parts of having COVID. And that seems to be perhaps the launch pad for this initiative.
Yeah, look, I think often in history, awful things and crises allow you to sort of take stock and maybe refocus on some stuff that they always knew about. Like I say, this strategy has been going on for 5 years, and it's taken Boris to sort of pull it off the shelf and get it back into working order. It's the beginning, and he says that in his release. But yeah, I think it's undoubtedly COVID-19 has amplified the emotions, it's amplified the science, and it's amplified the need to make sure that our British children, for all the reasons, are as fit as possible and ready to be as productive as possible.
As you say, at least a 5-year-long campaign. Why do you think previous administrations, I'm thinking of Theresa May's in particular, were seen as having watered down some of these measures? What was their thinking, do you think?
I think in hindsight, I think we started with Mr. Cameron. I've always been apolitical in how I work and how I stand, but I was one of the few, if not the only member of sort of civvy life to be involved in the creation of Chapter 1. That was looking good. It looked like he had 5 years ahead of him to do some good work. And then, of course, Brexit sort of changed things. Then it happened. Mrs. May came in and didn't have the support from her party, in my opinion. And now we have got to crack on. We are in crises. And Boris seems to be, I can't believe it, but Boris seems to be the one that's really kind of got a plan here. What we need is not one thing or two things. We need to have a kind of more environmental strategy where there are many, many things all pointing the same direction to make sure that our young kids have the best chance. And just to give you kind of clarity into why do we care and why is it utterly important to everyone in this country, no matter where they come from. If you're a kid and you're from a poor background, you're over twice as likely to be overweight or obese. We know that tracks into teenage years and early adulthood. We know that has correlation with low educational attainment. We know it means that on average you get paid less, you have more days absenteeism, cost the state more, and end up dying slightly younger than your well-off counterparts. So there is a kind of an inequality story here, evening the playing fields, and really about making sure that we're putting as much support where it's needed.
On the point about young people and young obese people, just give us a sense of emotionally how you feel when you hear people, as I have done down the years, and we've interviewed many of them on this news channel, who advance the argument that actually it's about choice, and it's especially choice for people who can't afford necessarily healthier food. I know we've been around that block so many times, but just give me a sense of the frustration you feel when people mount that particular argument.
It's very easy to kind of get onto a one-liner, sort of slightly tabloid view on a scenario and a person. We've got to just step back and really have a deep look. And I think, what we've learned in the last decade actually is that obesity is a normal response to an abnormal environment. And that what we need to do is, as a whole community, and that's business, that's the home, and the government, we need to really try to edit what we have and what we consider normal. And that's everything from, the geekiness of reformulating products and how clean our deck of ingredients are on snacks or dishes. It's school lunches, it's holiday hunger. Like the Marcus Rashford story recently was a holiday hunger issue. So what do we feed the kids that are on free school lunches? It's big, it's wide, and it does require a task force. The interesting thing is not doing anything. And I think partly that's why today is a little bit more organised and profound. And I think a lot of people are surprised how good this is that Boris has driven this forward. It's going to be more cost effective. It's going to be more ethical to do this. We're going to be more productive as a country going forward in the next 20 years if we can get these basics right. And
And that's going to matter a lot, given the current state of the economy. Just you mentioned abnormal environments. I mean, this is an abnormal environment we're living through now, and people in hospitality, you don't need me to tell you, really do find it an abnormal environment. We were talking to a campaigner an hour or so ago, and we were discussing whether there is any early evidence to make a connection between pandemic lockdown, people not able to go out and exercise, perhaps binging food, snacking, and whether there is, any evidence yet. She said, no, it's too early. Anecdotally, do you have any hunch as to where it's going? That, you presume, don't you, that people are staying in, they're eating more, and there's an effect on obesity there?
Yeah, look, I think in the months that roll out, we'll start to see if people have got healthier or not in lockdown. I mean, anecdotally, I think this has been a time for mass contemplation. I think not just eating, but nourishing has been a conversation huge online. I think that people have never cooked so much, and we've seen huge, unusual skews in all kinds of aspects of cooking. And I think, so we kind of have to look at this scenario as in, yes, we have been in lockdown. People realise that good food, getting more fruit and veg into your diet is beneficial to the immune system. The immune system is key to being in the best shape to deal with COVID-19 if you're unlucky enough to get it. And at the same time, I think there is social, mental health issues around the ability to turn a pile of ingredients that can be very, very cheap to get hold of and turn it into a delicious meal. So I think anecdotally, I mean, we've got one of the best, we have got one of the best, but we've got one of the biggest cooking websites in the country. And our numbers are more like Christmas. And Christmas is normally our time where most people, even the people that don't cook. So in that sense, it will be very interesting to see what's going on. But without question, people have been baking more, cooking more, and talking more about food and where it comes from and how it affects their bodies.
Yeah. And just to bring us full circle back to where we started, the specifics of what Boris Johnson, this administration, are looking at here. You mentioned pest to power, the idea of what happens at the checkout, stopping those promotions, the tug on your jacket from a child who sees that there's a promotion going on. Can I have one of those, please, Dad? To some of the bans, the watershed that we're going to see for online and TV, 9 p.m, the cut-off. What's the one that's catching your eye, the one that you think is going to make the biggest difference?
Online. I think the online's the Wild West. I think, most kids don't watch telly. And if they do, it's certainly not before 6. It's in the big highlight programmes. So we know that if you watch a full kind of primetime family show, that within the time of that series, you've watched a whole junk food film. So we know that's powerful. But really, for me, I think the online bit is kind of where the future problems really lie. Any parent that watches their kid, as do I, with their kids on, screens. It is the Wild West out there. I mean, we're short of quite a lot of legislation of what happens there and what our kids get served and what they see unexpectedly and what they're shared. And, it's, I think, a really good sign that they haven't tried to control the nuance of online. They've just said, none. Yeah. And I think I quite like the boldness and the clarity. I think it has surprised me, and I welcome it totally. And then for all the other groups that have been campaigning hard for child health, this gives us now a platform to sort of get on with some really good work.
Yeah. Just one final thought before you answer that call. You mentioned kids plural. You've got quite a brood, haven't you? I'm always curious as to how people with lots of children, how they coped during lockdown. How did you find it?
Look, I think from teenagers that just wanted to be out with their friends to a little 3-year-old that wanted to climb up everything and paint everything. It was colourful, to say the least. And I think, like a lot of families, the first 6 weeks were quite trying. I found myself unexpectedly doing not a live TV show, but pretty much within 16 hours every day, we were filming a cooking show that was very much sort of COVID lockdown based, about swap-ins and things you can do and how you can be creative with basic ingredients. So that was never expected, but it kind of kept me busy for a month. But I also got some real quality time with my kids and my wife, and of course I'm grateful for that. But what a time.
Jamie Oliver, really lovely to talk to you. Thanks for your time. Thanks a lot.